What's going on, guys? It's your boy Brad, back with another video. Now, before I get into this video, be sure to hit that subscribe button down below if you haven't already. I'm putting out videos every week trying to help you obtain your dreams of becoming a nurse. Enjoy the video. So this video comes as a response to a question from a viewer, and here's what they had to say. Could you please address nursing lateral violence, bullying, nurses eating their young, etc., and the fact that 2/3 of all new grads leave nursing before the end of their second year on the job due to this? So yeah, I know that we have heard this discussion over and over. It's almost to the point that it feels like we're beating a dead horse. Here's what I have to say about it. We know that nursing is a job unlike any other, a respectable profession, and one that should be treated as such. But nursing is the same as every other job out there in this regard. The fact that if you are a new hire on any job out there, whether you are mopping floors at the high school or if you are flipping burgers at Burger King, if the person that they assign to train you treats you without respect, talks to you as if you are inferior, it's going to make you not want to do that job, regardless of how much time and money and energy you have poured into the process of obtaining that job. I think that it's terrible that there are nurses out there, and I've seen this firsthand, there are nurses out there who have poured their heart into becoming a nurse. They've sacrificed so much in their life, financially, physically, emotionally, time with their family, things that they are not ever going to get back. Time is the greatest commodity that we have, and they won't ever get that time back. So they put all of this time into obtaining this career that they have been wanting since they got into nursing school. And they finally get their first job. They are finally a registered nurse. And then they get met with a reality that is very harsh and cruel. Obviously, I'm not saying that this is always the case, but this does clearly happen, or else this question that I got, these things wouldn't continually get brought up. I just think that it's so sad that we have people out there who are fed up with their job, they're resentful, whatever the case is that makes them want to eat their young. And to be quite honest with you, I freaking hate that that term. I hate that saying, and I'm honestly tired of hearing about it, but we can't. It's just a reality. Now, personally, I have come across some extremely phenomenal nurses who are humble, very patient people who really exemplify what I feel like a nurse should be. They're willing to take the time and nurture you. And that is really, and I know that nursing is not utopia. Some people out there might be thinking, well, if I got a new grad and I've got 6 patients to take care of and I have to worry about taking care, keeping an eye on the new grad and helping them learn, and just there's so much on my plate. But I just don't think that it's fair to the new nurse to take it out on them. The profession and these new nurses would be a lot better off if they received that nurturing, if these new nurses got nurtured, if they received those nurses who just take the time to help you learn, help you teach, help you learn the ropes of the job, and really facilitate your transition into nursehood, if you will. Because when these new grad nurses come out of nursing school, they really have no experience. I mean, clinicals only teach you so much, and most times by the end of your senior year, you're maybe get like 2 weeks of actual nursing responsibilities where you take on a full patient load, 4, 5, 6 patients. So if they come out of nursing school and have a nurse who is not nurturing, not patient, not willing to teach, just wants to get their job done, and because they have a lot on their plate and they may take out things on that new nurse, it makes that new nurse not want that job, like I said in the beginning of the video. And it may even push them to the point of not wanting to be a nurse, period. And I think that this whole eating of the young and bullying thing is one of the reasons why there is such a quick burnout among new grad nurses, why there are such high turnover rates. Anyways, I don't want to beat this horse too long. I got asked the question, and it's not the first time I've been asked the question, so I decided to finally make the video. At the end of the day, do unto others as you would want done to you. Nurse Bass, soon to be. Catch y'all in the next video.